the patient can be empowered. One of the speaker in the morning, specifically Elizabeth, she was telling that not only capturing the indicators, how you are putting these indicators into practice so that your patient will be safe and controlled. So that way also nurses can help in, or they also have an impact in the finance of the organization. I can have a number of examples to tell you where nurses can an impact, and I can also tell you that people consider nurses as the cost center, but it is not the cost center. It's a finance center. We can see in one of the talk. Again, because the time constraint, I don't want to go much into that. But surely, I will tell you that nurses has an impact on the finance aspect of the organization as well as the hospital. With this, let me call upon my first speaker, Mr. Adel Jeff. He is the founder and the managing director of Alpha Care Hospital. He will be elaborating on moving from the cost center to a business center. So till now, we were identifying nursing as a cost center. Now he is going to tell us the next 8 minutes that how the cost center can be changed into a financial partner. Over to Adel.
Thank you, Gracie ma'am. And thanks, Annie, for the wonderful opportunity. Nurses, if you think your job is very hard, my job is even tougher. Talking to a group of audience after a sumptuous lunch, some half asleep, some don't know what to do. But hope if I can't make you keep you awake, then I'll have to take the help of the buzzer. So, finance, yeah, for nurses and ladies, finance is not something new to you. You manage your home finance, you manage better. But are you doing it in your organization? Are you open to the concept of understanding the finances of your organization? I doubt that. So I think it is time that you understand what nurses, how you perceive in an organization and how you can do better. So I'll be talking about how, as a nurse, the traditional approach has always been nurses were perceived as a cost center, meaning you're a cost to the organization, meaning cost can be controlled, meaning limited resources of nurses. So what happens then? Cutting short on number of nurses when the occupancy goes down, reducing the training cost or any efforts to upskill the nurses, and no recruitment of new nurses or recruiting nurses who are freshers who fit in the organization's manpower budget. So this is what happens when nurses are perceived as a cost center. And what happens to a nurse? Due to all these limited budgets, they are overwhelmed with work. They're not trained, they're not motivated, they're not inspired. They're clueless in their job, piled up with a lot of work and documentation as per all the accreditation standards. And finally, they feel disconnected with the organization. They do not know what to do, they keep shifting jobs, and they're never happy in any organization. So the only good thing can happen is, unless you change your thinking, your perspective of how you need to be perceived in an organization, nothing is going to change, and the change starts from you. What does it mean to become or seen as a business partner? You don't need to invest your money. You don't need to invest your personal finances. All you have to invest is your time and effort and a little bit of commitment shown from your side to the organization, more than you've already been showing to your patients. And what does it mean to be a business partner? As I said, you have to create value addition. What value do you contribute to the organization. And it is, this value addition is evaluated through your performance metrics. And nurses have to be involved in decision making. Not just following decisions, you have to be part of every decision making happening in the department or in the specialty or in the organization. And you will also have to be part of revenue generation. The organizations don't expect you to go out looking for sales or patients or doctors, but reduce medical errors, which will drastically or significantly reduce readmissions, and the patients are happy going back home. That will add to a lot of revenue generation. More patients come after that. And innovation is one major characteristic. You have to be innovative. You have to be innovative in the organizations, as per the organization's goal. What if the organization wants to expand? Then home care is a concept that you can also be part of. So innovation and new ideas is a need of the hour. And leadership. To be a leader doesn't mean that everyone has to be a nursing superintendent or the CNO of the organization. Leadership doesn't reflect on your position. It is your attitude towards taking up a task and completing it for your own sake and for the organization. And what drives these change? There are just three major features or pointers that I would say. Value-based care. Basically, the mindset has to change. If you're not able to change anything, you would have to try and make sure that the change starts from you. Okay. And these are the three drivers that could go on to that change. Value-based care. More benefit for the patient with less cost. And reducing errors, reducing medical errors will significantly have a positive impact on this value-based care. And patient-centric care, a lot of people have been talking since the morning on patient-centric care. There's nothing new about it, but yeah, it is possible through continuous quality improvement. And technology, adaptation to technology. Please be open to the new technologies that have been implemented in your organization, because that is going to be a drastic impact on the way you're working, and you've been working, and you will be working. And how do you achieve that? Continuous training, again, is not something new I'm going to tell you. Continuous training and upskilling is something as nurses, you will have to realize that is required. Everyone needs to go through a training process. You have to keep learning. Otherwise, you will be left back in the crowd. Empowerment is, again, we've been hearing from since the morning. Data analytics. Nurses have to be aware of the data. You have to know what you're doing. You have to analyze the data, the medical errors, the incidents. All this data will help you work better. So please keep track of the data corresponding to the work. And as I said, innovation and research. This ultimately will increase the trust and loyalty of the nurses in the organization. And what can you do? First, you need to stay back in India. That is the first thing you have to do. After learning, after upskilling, after training, learning a lot from India, not leaving India, and stay back and contribute to the organization and the society as well. So this is all in your hands. Again, I'm repeating, updating your knowledge, upskilling, networking. See, attend such conferences wherein you network and get to know people. That is going to be helpful in your professional career. And open-minded listening. I can see, I've been telling a lot of people, the organizers, I've never seen a crowd so attentive. Since morning, the crowd has been almost the same. So it's good. It's a good characteristic for a nurse. If you want to improve your professional career. And interdisciplinary learning, meaning you have to go beyond your boundaries to learn new things, be it technology or IT systems or other, quality or whatever it is. Keep learning new things. And also handhold your fellow nurses. You have to rise up, wise up, and eyes up. Rise up, you have to have the attitude to go up. And if you want, see, all the nurses who are there, if you want to come up to the stage, you have to rise up to the occasion. And wise up, that is possible only if you upgrade yourself with knowledge and learning. And eyes up, look up, and keep moving forward. Wishing you all a great learning today. Thanks for the opportunity.
Thank you, Adil, for that wonderful presentation. He has very clearly said, if you want to grow, you have to remain in our country, okay? But, so you think about. But I will say, I am not forcing you to remain in the country, but I will say, if at all you remain here for 1 year, or 6 months, or 2 years, do your best for your organization. Whatever you have learned, do your best for your organization. With this, I just move on to the next speaker, Dr. Meera Achrekar. Meera is the professor and nursing CNO of Tata Memorial Hospital, and she will be speaking on nursing budget impacting outcome.
So good afternoon, everyone. My topic has been made easier by Mr. Adil because he has covered up many of the points. But I think the statement itself is very clear. Nursing budgets will impact the outcome. So, why is nursing budget important? Because for optimal patient care, you have to maintain the staffing levels, support nursing training and development, provide necessary equipments and technology. You have to control the cost, and most important, you have to also comply with the regulations. Without sufficient funding, healthcare organizations will deliver to provide high quality nursing care, and finally patient care will be affected. Okay. So there are three important aspects. One is staffing, one is training, and one is the resources. So we will just look into this. Adequate staffing is crucial for providing safe and efficient care. All of us know that if the nursing budget is not adequate and if the hospital has not permitted for recruitment of nurses as per the nurse-patient ratio, you know what is going to happen. If a nurse has to care for 10 patients or 15 patients, obviously the care is going to get affected. So this recently happened in my organization also, where suddenly so many nurses left. And I used to proudly say that my pressure ulcer rate is very low. And suddenly the number of pressure ulcers which came in became very high. Why? Because suddenly there was a crunch because many of the nurses had left. So we know that less number of staffs will create a problem where patient care is concerned. So in some hospitals which are not into competitive market, it may not happen that the patients say that nurses are not there. But then in competitive markets where we have hospitals competing with one another, deciding that more patients should come to us, here it pays dividends because having good nurse-patient ratio will ensure that you have a satisfied customer and more patients will visit your organization. Okay, so another way we can have, one is bedside nurses, which we have, who will be taking care of the patients who are at the bedside. Another important aspect is where you have case managers or people who are communicating to the patients. So this is very important because it leaves the nurses to take care of the nursing role which they are doing at the bedside. There are case managers who will be able to handle patients, the health care team, and will be able to solve the problem. So these are also an important aspect. When you're looking at the budget and staffing, you must ensure that enough of senior nurses or care coordinators and communicators are available. Second important thing is preventive care. I think we all know that prevention is better than cure. You don't want the patient to come to your hospital and consume your time and the length of stay in the hospital. If we can spend some time providing preventive care to the patient, I think this will go in a long way to ensure that whatever staffing we have, we are able to take care of the patients who are in our hospital. And next important thing is quality care and patient safety. It is also important, I think we are going to have a talk on that also. Retention of nurses and having skilled nurses is very, very important. Many of the time we have senior nurses who are leaving the organization, new staffs come in, so much of time goes in training and mentoring. So if we are able to retain the nurses who are here by providing them a good work environment, providing them with adequate salary and facility, and providing them a good work environment, I'm sure the senior nurses will be able to be retained in the organization. And we could also use resources which will help. For example, we know that there are remote monitoring systems. We have nursing assistants who can help us with the basic hygienic needs or care needs or ambulation needs, so that the nurses who are experienced are able to devote more time to focused patient-centered care. Next important thing is training and education. I think when a new nurse comes into the organization, especially if they come to an organization like ours, where we are an oncology-based organization, the nurses who come in will not have any idea on how to take care of an onco patient. So this is very important. So the time that you spend is an investment. It should not be thought about something as an expenditure. Investing in training and education of the nurses goes in a long way to make a nurse more confident. So a robust nursing budget will enable facilities to ensure that ongoing education is there and they are provided with the necessary knowledge and skill. Then resource availability. So if you have enough of money, in the budget is there, nursing budget has allocated for technologies, like you have air mattresses which are there, you have infusion pumps which are there, today we have hoist and monitoring systems. So many systems are in place. So if facility is provided, if the budget is provided, and we can make use of this technology, it will ease the nurses' work. So this also says that as nurse leaders, strategic planning is very, very important. You should know how to do resource management and focus on efficiency without compromising patient care. So one of the most important here is workforce optimization. We have ratios which says that we used to have 1:5 or 1:6 ratio in a general ward, but it depends on the acuity of the patient. Sometimes you may be able to give 1:6 if your patient is stable. Sometimes in that same area you may have to give 1:1, not necessarily in the ICU. Sometimes you may have a patient who requires constant monitoring. So based on the acuity of care, you should be able to manage your nursing staffs. Then I already mentioned to you about utilization of technology. Today EMR, telehealth platforms have come, remote monitoring systems have come. This can help in ensuring that the staffing that you have is adequate, and plus the nursing budget is allocated for this technology to be in use. Next important thing is prevention of complications. I think this was also mentioned. If you are able to take good care of patient, complications in the patient like hospital-acquired infection or pressure ulcer or fall, all this can be prevented. So prevention of complications is another way how we can improve our nursing budget. Also having budget for quality improvement initiatives. So and nurse-led research which is to be conducted in the hospitals. So today many more nurses are coming to undertake small research studies, which is really interesting, but then the hospital also has to provide resources for them in terms of money, because money is required where research is concerned. So I think as senior nurses, when you're planning the budget, you need to define the budget objective. You need to review the historical and actual data which is there. So data analysis is so very important, because for this you will have to develop a base budget, After finding your actual budget, you will be able to show the organization, okay, because my nurse-patient ratio is this much, my staffing is good, I am able to prevent all this. So this analysis is also very, very important. So you need to monitor outcomes and analyze the variances. Again, and whenever there is a need to amend, you need to amend your budget. Maybe sometimes you can decrease it because of the type of care that you give, but most of the time you may have to increase your budget so that you incorporate all these aspects into your nursing budget. So I think that's it. Thank you so much. In conclusion, I would like to say, adequate funding for nursing resources is essential for optimizing patient outcome, ensuring quality care delivery, and promoting patient safety within the healthcare organization. So investing in nursing budget not only benefits patients, but also contributes to the overall efficiency and effectiveness of healthcare system. Thank you so much.
Thank you, Madam, for finishing on time without any bell or anything. So thank you so much. She has elaborated that good coordinative work as well as communication, as well as education to the patient and training to the employees can bring financial impact to the organization. Now let us go further with Ms. Josephine Cyril. She is the Chief Nursing Officer, Sri Gangaram Hospital, New Delhi. She also the President Haryana chapter of ANEI. She will be discussing with us regarding the recruitment versus retention and its financial impact.
So good afternoon, everyone.
Good afternoon.
Hearty congratulations to ANEI for organizing such a beautiful conference. Topic is very interesting, and when we just concluded celebrating International Nurses Day, and we spoke almost on the same topic, economics, financial impact. And today, luckily, I got the same topic. I'm happy. So the same topic, I had the opportunity just recently at Sir Gangaram Hospital. I had to speak on International Nurses Day. We celebrated it for almost 3.5 hours, beautiful event where from top management, everyone was present. And you won't believe the impact. You know, I was listening to all the talks in the morning that made it. They announced several awards for the nurses. They realized how powerful we are, how talented we are. So we have to bring it to the table. So my topic is recruitment versus retention, financial impact. Today's highly competitive healthcare industry, and that too in this time when we are struggling with having the best talent available to us, especially as nurse leaders and even mid-level managers who are managing all the shifts. It is a huge challenge in front of us to have the best talent on board. And talent on board means not only we always talk about clinical area, that means patient bedside management, the clinical care, the delivery of care. Most hospitals are today accredited, whether it is a small healthcare or a big healthcare, and we always think about quality care, patient feedback. We keep hearing that in every forum. But I noticed one thing. Today I see nurse managers managing not only patient care, they manage bed management. They manage a home care service which the hospital is providing. So what I can say, there is huge demand for having the best talent available in the organization, not only in the bedside area, but throughout different sections in the hospital. So organizations are grappling with the idea of whether we should retain the employees who are talented to stay with the organization, or rather we go ahead and be busy with recruiting and recruiting and recruiting. I tell you friends, there was a serious boardroom meeting happened in our organization where the same thing was debated, because nurses were paid quite well and the benefits are many and attrition is lowest. So there was one side talking, are we paying too much to them, or we should go ahead with the recruiting and reduce certain benefits for the nurses. And you know, one statement came from the chairman, I really salute him for commending It is better to keep the talents which are already in the organization to be there with the best of facilities, with the best of benefits. And he asked the sitting doctors only one question: are you all not happy that your patients are well taken care? And there are no complaints coming from. Their prognosis is good. They are going home happily. Are you not sleeping well with the peace that your patients are in the best of hands? And that meeting concluded with excellent support coming in favor of his that one statement. Nobody debated with him, and the benefits and all the allowances, whatever is existing, continues to do so. So I am putting a question to all the audience, young nurses, senior people sitting here. This whole preparation, I went through a lot of studies, a lot of articles at the website, plenty are available. When I looked at the topic, I thought it may not be there. They might have written about general recruitment to various companies and other institutions. I never thought people will write so much of research studies, minute calculations, various metrics to calculate on nursing recruitment and nursing retention. Beautiful articles written by Indian nurses and Western nurses. So we are in the picture today, and I tell you friends, especially to the young nurses, coming 10 years is our time. We are going to shine. We are in demand. And our attrition rates are going to high up, and people will talk about us. Now, I'll just come straight to the point. Why people leave? Because of relocation, personal reasons, career advancement, salary reasons, all of you know. And in India, nurses generally retire between 35 to 45. Personal life and work-life balance, difficult to manage. And emotional distress and job satisfaction very low. So these are the main reasons why our people leave. And recruitment, when it comes, the average cost of recruiting a nurse, as per international studies, they spend thousands of dollars, in fact, millions of rupees in our calculation. And you know the cost coming to almost an average of 9 months' salary, recruiting an employee on board when there is a huge gap. So while recruitment is crucial, keeping the fresh talent, now getting a fresh talent is another challenge. The financial impact is so much. So the organizations today, many organizations, how we are keeping the retention part strong, and so that our best talents will not leave us. Studies have shown that if we have an excellent mentorship program, that means we have taken good people on board, trained them, kept them on board, that orientation and mentorship and nurse residency programs are hugely successful today in Europe and all the Western countries. Nurse residency program, which even in India, some of the hospitals have already started. So, specialty-wise service, positions what they held, based on that, the feedback, we need to analyze and then come with the solutions. So frequent check-ins, once people are on board, frequent check-in with them so that they should not leave us. When you keep checking, especially with the first year of nurses, people maximum leave, half the population of nurses live in the first year of their joining the organization. So we as nurse leaders have a huge responsibility to make sure, frequently check with them, is everything fine with you? Are you getting the right support? And keep on progressing. From each interview, each feedback, work on your strategy. So very, very important points I have put here. The impact of finance comes here. The source of hiring, from where you are recruiting. People spend so much of money in getting the talent, traveling here, there, and you give offer letters, come back. That same employee gives some recruitment interviews to 10 other institutions, and they don't join us. How much money we spend, time and money. Candidate experience, very important. We always look for experienced people. Both have its own weight. Experienced people may stay with us, but even freshers someday, if you treat them well, they stay with us. So hiring continues to be a challenge. I tell you one thing, many times we make the mistake of, we let the good employee leave without giving an increased salary or some benefit the person has asked for, but we hire at a higher salary a new employee. Again, making a decision which may not be correct on many occasions. So recruitment costs are increasing day by day, and the only opportunity what we have as nurses in front of us is training and development. quality of training, in-depth training, need-based training, innovation in training, training requested by the employees, what they demanded, we focus on that. So this is what my conclusion. If we want our financial impact to be strong, not spending unnecessary money, thinking about organizational goal, organization vision and value and everything in support of the organization, and to work as a team. We all work in a collaborative work model. Support for, yes, I know, I'm hearing. Support for education, working with competent co-workers, and positive nurse-physician relationship, nursing autonomy. We need to be autonomous. We have to fight for it. A working culture that replaces emphasis on the patient first and control over nursing practice, adequate staffing, and administrative support. This is what we require. I'm concluding, Tangam. So wear and tear, that is what the nurses who are remaining, they get tired, they get exhausted. Another impact, they commit more mistakes. And they are frustrated, either they are absent or they just leave the organization. Another financial impact. So coming to the last, time to fill is one thing, but the cost is at another. So I conclude here with one thing. It is a business problem. My previous slide is showing. It is not an HR problem. Today, if we talk about recruitment or retention, it is actually becoming a business problem. So nevertheless, one good thing with this word recruitment, retention, financial impact, one good thing, world has realized nurses, they are the heart of the hospital. They are there from birth to death, and they are the life of the hospital. If nurses are there, professionally trained, highly skilled, modest in behavior, excellent in communication, and they work with the team, everything is there. There is life in the hospital. So that people came to know through this shortage and through this situation of financial impact. So it is a huge business necessity. So my takeaway points in the previous slide, I just want to tell you the key takeaway points. High rates of nurses turnover creates a vicious circle that we keep recruiting, we keep worrying about the people whether they will leave or not. So at the end of the day, that we need to balance that vicious circle. High nurses turnover costs healthcare institutions both directly and indirectly. There are a lot of hidden costs which we do not calculate. The hidden costs, if you list, it is a very long list. Our attrition rate and retention rate, we have to meticulously calculate month on month and annually. And the only solution which is coming, which is really interesting, is the technology, better technology. So where nurses are less, and recently we started with an ANEICO ISO, you can really have everything through system. And of course, we have seen technology outside displayed also. Now technology is going to support us a lot to fight in this situation. Thank you. I'm sorry for taking extra time. Thank you so much.
Thank you, Rosalie. Thank you, Josephine. As such, though you have taken little time, but you have very clearly elaborated the merits and demerits of the retention of our old employee, as well as repeated recruitment of our employees. I have much to add, but again, because of the time constraints, I don't want to add. We go to our last speaker of the day. Dr. B. Krishnamurthy, he is the director of DAK Healthcare Consultancy Private Limited, Chennai, and he will be speaking to us the impact of errors on patient and organization. Over to Dr. Krishnamurthy.
Gracie ma'am, Clara ma'am, and Rosalyn ma'am, thank you very much. I feel a little out of place in this august nurses gathering. I sincerely hope I fail as an anesthetist and don't put you to sleep.
Put the mic a little.
We human beings still provide health care. Artificial intelligence has not come in yet. Human being is defined as something which commits errors. While we work in a healthcare, we face the dirty dozen. I have just put it here. We have severe work pressure. We are working in a noisy environment, even though hospitals are supposed to be very silent places. We multitask. We are experts. We take shortcuts. We do workarounds when there is a safety barrier. We are distracted always. And sometimes we are unmindful because of our circumstances do not allow us to be mindful. When we are like this, we commit unsafe acts. When unsafe acts are committed in the presence of a hazard, then we can cause either errors or violations. Errors are slips when we do something which we are not supposed to do, act of commission. Lapses when we forget to do something, act of omission. Or a knowledge-based thing, when we can do either A or B, we choose the wrong choice. At-risk behavior is when a nurse who is supposed to do double check for blood transfusion uses the checklist as a tick list, then it becomes at-risk behavior. Reckless behavior is when a doctor, surgeon comes drunk and operates on a patient and harms the patient. So, the moment clinical errors are there, they can impact the three major stakeholders of any healthcare organization. First victim is the patient. Second victim is the clinician. By clinician, I mean doctors, nurses, and technologists. And the third victim is the healthcare organization itself. I am supposed to talk about the first victim and the third victim. Now, all errors need not go to harm. Some errors may be perpetuating an error-prone condition. Some errors will result in no harm or near-miss events. Some errors will cause harm, and the harm can be mild harm, moderate harm, or serious harm. It can lead to death of the patient, and occasionally some of these harms can be characterized as either sentinel event or never event. Now, what is the generic impact on the patient? As soon as I land up with an error, I will need to undergo extra investigations, extra procedures. I may need to take extra medications. I may have to undergo more intensive therapy in an ICU or HDU or somewhere else. My length of stay may be increased, thereby increasing the cost of care, and I may have increased suffering, including pain. It may disturb my job, it may disturb my family and my relatives, and it will lead to loss of trust with me about the hospital, and it can cause psychological issues, especially post-traumatic stress disorder. Now, just by being a patient in a hospital, I can land up with some generic healthcare delivery issues. These are healthcare-associated infections, decubitus ulcers, falls, DVT with VTE, infusion-related complications. They showed excellent pictures in the morning, disconnection and misconnection issues, restraint-related issues, delirium, and we may be forced to have self-harm or suicide. But specific patient harms come from the processes which are done to me as a patient. It may be clinical diagnosis, laboratory diagnosis, radiology diagnosis, general healthcare delivery, medication management, surgery, procedures, blood transfusion, CPR, transportation, teamwork and handoff, and transition and handoff, teamwork and communication. And it can also come from the structure in the hospital in terms of information technology, equipment, and instruments and environment. It is not possible to go into the details of each. I will try to show some pictures and satisfy you. Diagnostic errors are very common today, and they are the ones which lead to court. You may have a misdiagnosis, delayed diagnosis, or a misdiagnosis. Your complications may be missed. And these diagnostic errors can lead to big problem. For example, this child had a flesh-eating bug, but triage missed it, and it had to lose some portions of all 4 extremities. Diagnostic errors have become so common that JCI is planning to introduce it as the 6th patient safety goal, international patient safety goal. You may be wrongly identified. This patient who was pregnant for 3 months into pregnancy, had a full-fledged CT scan of the abdomen because she was wrongly identified. This child had a left eye operated instead of the right eye. This patient received a heart-lung transplant with a wrong blood group and died. This is the worst. Instead of a tongue tie, they did a circumcision for this patient. Sometimes in our enthusiasm, we may leave behind things which we don't want to do, like a large piece of cotton swab was left inside this patient. People have been injected, instead of antibiotics, rabies vaccine, instead of COVID vaccine, they have been injected rabies vaccine. Rabies vaccine seems to be very interesting. Look-alike, sound-alike drugs can lead to many medication errors. You may do a procedure wrong. This person was about to be discharged, had his central line removed in a wrong way and developed an air embolism and died. This person who survived a head injury and multiple trauma developed MRSA and passed away due to a healthcare-associated infection. You may be thinking that you are anesthetized, but you may be only paralyzed and be totally awake and aware during your anesthesia and surgery procedure. You may be lost because you are demented. You walk around, you go into a cupboard and get locked up self, and nobody discovers you for 3 days. Okay? Misconnections are the most dangerous. Here, the child had an enteral feeding tube connected to the tracheostomy, thereby feeding his lung. Here, an epidural tubing was connected to the intravenous tubing, and patient died. Here, an enteral feeding tube was connected to an inline ventilator suction, this leading to a problem. And finally, some nurse discovered a new method of measuring urine output by connecting the Foley's catheter with the NG tube. So now I come to the third victim, the organization. The organization will have negative impact as soon as an incident happens. They will need to do incident analysis. They will learn to avoid recurrence. They will have to create a risk management team, need to report externally like hemovigilance, pharmacovigilance, materiovigilance. They will suffer reputational loss. They will need to face consumer or other courts. They may develop facility hazards. They may have a violence against the organization or the staff. They may face financial issues with problems in EBITDA and ROI. And finally, they may have to change their strategic plan or operational plan. They may have a bad publicity and bad reviews. The consumers may have a growing distrust, dissatisfaction, or discontentment. They may feel that they are not getting value for money, and they may become disloyal and leave you and go to another organization. So Great Ormond Street Hospital, syringe swab, instead of dye, the technician gave glue, 24 million pounds. Here in India, we have paid 6 crores plus interest, about 11 crores. Some radiological diagnosis was missed, 1.25 crores. Now I come to hazards in facility. Somebody can store formalin in a Kinley water bottle and leave it in the fridge. This poor resident drank it and landed into trouble. You may have 2 minutes.
Dr. Krishnamurthy's time is over.
Violence against the organization, flood damage, fire incidents. But this is the most important one. Sometimes incidents can lead to good things also. ATLS, anesthesia monitoring, fetal heart monitoring, WHO surgical safety checklist, sponge counts, allergy documentation, concentrated electrolyte safety, pressure sore prevention, occupational safety, including weight lifting techniques and lifting equipment, all have come from positive impact of incidents. So incidents will have both negative impacts, mainly negative impacts, and they may have positive impacts. Thank you very much.
Thank you, Dr. Krishnamurthy. Now, all of you have seen that how nurses can have an impact on the finance. Now, because all these topics, what very clearly what they have mentioned, that if you engage yourself in preventing the care and continue patient education, if there is a care coordination between you as well as to the other people, and if you are much bothered about the quality care as well as the patient safety in your area where you are working, your risk management as well as error identification at every level, if you are going to identify the risk and then you are going to manage this risk and you mitigate this risk in the appropriate level, and the appropriate utilization of the resource and the waste reduction, preventing healthcare associated infection and the complication, continuous training to our nurses, and of course retaining our old people because they are gold. We follow all these particular type of things. If the management follow, if the nursing leaders follow, and the nurse are those who are really at the bedside follow, we can see that there can be a great impact, financial impact on our organization as well as to the patient. And the organization feel the need of the nurse. They feel that I require this nurse. Otherwise, what has happened? They'll say, no, if there is no nurse, I can get the work by someone else. They feel the need of the nurse, and then we can go further. Now, it is open to the forum for any question. No question? Then thank you so much. Thanks my team members also for your wonderful presentation. Thank you so much.
Thank you, Gracie ma'am and esteemed faculty for enlightening us on the expanded role of nurses, demonstrating that their contributions extend far beyond bedside care, positioning them as vital architects of the healthcare system's economic well-being. We request the leaders to pose for a photo at the photo corner.